everyone to a session of A Simple Practice, which is an initiative by Dr. Shakti when she is having a conversation with me, and I'm your host Akshat Sinha. Today's session is about the chemistry of heartburn. First of all, welcome to the show, Dr. Shakti. Thank you so much. Thank you. So most of you know that she is a visiting consultant with Max and Apollo Hospital in New Delhi. And in this series of talks that we are doing, and today's being the chemistry of heartburn, I want to actually ask her what is the mystery behind it.
Hello everybody, thank you for the introduction. So I just want to start with what is heartburn, right? You want to know what is heartburn.
Right.
So what happens is that when we eat, the food goes to our stomach. Very simple, we all know that. And so it passes to the stomach through the food pipe.
Right.
So the food pipe is connected to the stomach with a valve, or what we call a sphincter in medical terms.
Right.
So this valve, it opens only when we eat and allows the food to pass through.
Right.
When we, so this valve also, we know that the stomach produces acid to digest food.
Right.
And the stomach is very well protected from this acid.
Okay.
The lining is quite thick and protected.
Right.
But the lining of the food pipe is very
thin.
And if the valve, if for some reason is not working properly,
right,
the acid from the stomach can backflow into the food pipe.
Okay.
And because we know that the lining is very thin and sort of flimsy, it can be very easily be damaged
By the acid that can
yes,
rise from the stomach.
Yes. So this is what we call heartburn, because this backflow of acid produces a burning-like sensation in the chest.
So you're trying to say that heartburn actually, in most cases, does not have anything to do with the heart?
Yeah. Yeah. So the heart is also, we know the heart is also in the chest, and the food pipe is just behind the heart.
Right.
So that is why this term has come, because the burning sensation is in the middle of the chest.
Okay.
In the area of the heart.
Okay.
So fortunately, heartburn is in 99% of the times it is related to this backflow of acid.
Right.
But in 1% of people, it can be because of heart problem as well. It can be angina, which presents as heartburn.
But in less than 1% of the cases,
yeah,
as you mentioned. But it is something to be considered.
It should be, yes.
So in the general practice, what happens, so when you have a heartburn sensation, is it the same thing as an indigestion?
That's a very good question. So indigestion is a broad term.
Okay.
It includes heartburn. Like indigestion means, when we go to, I don't know, attend a wedding. I don't know, nowadays it's not happening, but nowadays it's not happening. But when we attend some wedding or some functions, then we tend to overeat.
Right.
And so indigestion can include feeling of fullness in the stomach.
Right.
Or it can include, even pain or feeling of nausea, which is a tendency to vomit.
Okay.
And even belching or burping. So this is all indigestion. It is related to stomach problems.
Right.
And heartburn is also a stomach problem. So it is just another component of indigestion.
So
heartburn,
although it originates from the stomach, is felt in the region of the heart.
Yes.
In that area, which is why we call it the heartburn. So what causes this? I mean, what are the reasons for this?
Mm.
Like you mentioned, overeating
Yeah.
is a part for excessive eating can be a part for
Yes.
indigestion. For heartburn, what are these factors?
Yes. So it's almost the same for heartburn as well as for indigestion.
Okay.
So it is what we eat and how we eat.
Right.
So how we eat is very important. Like overeating, you cannot resist temptation of eating.
Right. That's true.
Or eating too fast.
Okay.
Um, Again, same thing. You cannot
Control.
stop. Yes,
Yeah.
control. Or supposing you keep do not keep regular timings.
Right.
So the acid is formed,
Mm-hmm.
but there is no food in the stomach. Or supposing you skip breakfast or a
Okay.
meal,
Right.
so it can cause that extra acid to overflow or backflow.
Right.
So how we eat means, irregular timings, eating fast, not chewing properly, or eating too much. And what we eat, it includes, having spicy food or
Okay.
fatty and fried foods
Right.
mainly. But can also include, tea, coffee, and carbonated drinks like cold drinks and some juices. So this is what we eat, what we should avoid.
Right. So, I mean, this term, which is acidity, would it be
Yeah.
similar to this, where we have this feeling, that
Yes, yes.
it
So
is-
actually, it can heartburn can also be, like the reflux can be so strong that you can actually feel it in the throat. So we have seen cases when people are suffering from dry cough for
Okay.
many months,
Okay.
and then we come to know that it's because of reflux.
Right.
So coughing, and because it irritates the vocal cords and the throat.
Right.
So dry cough or sore throat, lump in the throat. These can also be symptoms of heartburn.
They most probably manifest after over a long period of time.
Yes, over
over a period
several
of time.
weeks. Yeah. So the sphincter or the valve, it
Mhm.
gets weak
Okay.
because of these our lifestyle and everything of what we are not eating properly or how we are not eating.
Right.
So all this, they weaken this valve,
Mhm.
and the backflow is not prevented. So when this happens, it is called reflux.
So basically, this valve that we're talking about, this sphincter, basically works as a single side valve.
Yes.
So it allows unidirection,
Yes.
and it is supposed to close down so as to not allow. So this no return valve becomes weak, and then the flow is not maintained, or it is not contained by this valve.
Yeah.
So thank you very much, Dr. Shakti, for giving us these basic things about it.
Yeah.
I think there is a need to consider these what and how
Yeah.
we eat, and our lifestyle changes if necessary, and what can be done to do about this.
Yeah.
And I think one important question that we will also need to consider is when should we approach for medical help? When should we reach out? I mean, in India especially, we have this habit of popping pills and pudin hara and all these things to kind of build them down. Is it a good practice or a bad practice? Maybe we should come back in the second part and discuss about these things, about the what, the how we eat, and what needs to be done. So thank you so much, Dr. Shakti. Any last words that you would like to share?
I think you've understood, I guess,
Right.
what and how,
Right.
and you can even share your experience if you have any. Or like, for example, I try to maintain my timings, but
Right.
sometimes I do overeat or eat
When the food is
extra.
very tasty.
Yeah. Yeah, when you cook. So.
Yeah. Thank you so much.
Or I think you have stopped having coffee. So can
Yeah,
you
that's
share your
one thing that I have
experience?
done in the recent past. I realized that I needed my fix of strong black coffee in the morning, at least to start off my day. I just one day decided, because obviously these reflux situations are not uncommon to me
Yeah,
as well.
everybody.
So I decided to do this one bit and try, and getting off it has been very difficult for the first 1 week. I was very low, and I realized the kind of addiction that can be there, and I didn't realize it while I was. Thankfully, I stuck by it. I tried a cup of coffee and I didn't like it, so I think I have moved on from that. So yeah, hopefully it will be a good start to more active and more things that I need to do in my life. So thank you very much, Doctor Shakti, and thank you for suggesting that. Thank you, listeners, for listening to us, and we'll be back soon with the second part. Please join us there. You can always look at our YouTube channels, which is A Simple Practice, which is run by Dr. Shakti, and my YouTube channel is In Conversation with Akshat Sinha, where I have conversations with medical specialists, with specialists from mental health, and from the art field as well. Please follow, like, share, and subscribe. Thank you so much.
Thank you.